Thank you guys both for taking the time to have this conversation today. I know there are a lot of people, as we were just talking about, in this country and around the world who suffer from TMJ. So I want to get into, what are TMJ pain disorders, and let's just start with that. What is the job of this joint, of the TMJ, in our human anatomy? And if you could give it to me in layman's terms, how this joint can cause pain and discomfort, and how it really significantly can alter someone's daily life.
Yeah. So the TMJ is a very interesting joint. It's what actually connects your jaw to your skull. So it's an extremely important joint. It's one of the most powerful joints in our body. And so this joint allows us to do almost everything. It allows us to eat. It allows us to speak. Allows us to swallow. Without this joint, we can't do any of that. Our facial expressions are the joint is necessary to have facial expressions. And so we use this on a minute by minute, second by second basis. And when you have pain coming from the TMJ, it's a pain that's there not just when you eat, not just when you sleep, not just when you're swallowing, all the time. And it can be very, very severe. We hear about it in the mild cases where it's clicking and popping and they have pain when they eat. And then it gradually gets worse. And then it gets to a point where it's constant and they have pain on the side of the face. And then it gets really bad. And then we see ringing in the ears. We see dizziness. We see headaches associated. We see neck pain, postural problems. And so this is something that can be absolutely debilitating to a point where people don't want to leave their house anymore. People don't want to eat. We see lots of weight loss with this disorder. And so it is a terrible, terrible disorder if you don't get treated early and wait till it gets too late.
Yeah. And Dr. B, you're talking about what causes this, or really how it impacts our life. I want to get into the causes in just a second, but Diego, in your work as a physical therapist, talk to me a little bit more, expand a little bit more on what Dr. B was just saying about what do you hear from the patients you work with? How is this impacting their daily lives beyond what he was just talking about?
So for like a normal professional, right? Think about sitting in front of your computer right now. That jaw pain can lead to headaches, right? It can lead to you being unable to focus on work, being unable to even use a straw because a straw increases the intraoral pressure, right? So all these things where you like almost take for granted, that's pretty much going to affect every single point of your life, right? Even talking to your friends, going out with your friends, going to eat, like, hey, we're going to go try this like tapas bar, right? It could be a lot of chewing. Got to be careful with that as well. I've had a patient that had to drop out of school, because the amount that she had to study, sit in front of a computer, sit like in class, was totally debilitating for her because she was getting headaches. She was getting constant jaw pain. You name it, like nutrition wise, big for people who want to work out. That's one of the things that we recommend at PT. Like, hey, let's make you more capable. Let's increase your capacity. Well, you need protein, carbs, and fats, right? A nice healthy diet to be able to do all that. But if you're not able to get all your macronutrients, it impedes your ability to heal. So now it's a vicious cycle of constant pain. And when you want to get better, you can't. And it just becomes this whole, and then develops a chronic pain. And now you're experiencing pain in other places other than your jaw. And it becomes it's really something that can't be controlled.
And it's commonly misdiagnosed, right?
Yes.
One of the things that we see all the time, especially in my clinic, and I'm sure you see it too, Diego, is that they come in not with pain in their jaw, not with clicking. That's not what we see. We see with severe headaches. We see with neck pain. We see with neck tightness. And so, it's not as easy as them telling you, hey, listen, I have TMJ. Can you treat me? It's them coming in with, I have severe pain. I am, withdrawing from my friends. I don't know what to do. This has been going on for a long time. What can I do? And you really have to tease out the fact that it's actually coming from the TMJ.
Yeah. Who knew that a little joint could like overtake everything, every part of your life and every part of your body. Dr. B, what causes this pain disorder?
Yeah, there are a lot of reasons why you can get TMJ or TMD. TMJ is that hinge joint, and the hinge joint is made up of two bones, and then between the two bones, there's the shock absorber. There's the disc. So you can have a problem with the bones, or you could have, which is like arthritis, or you could have a problem with the disc due to either degeneration of the disc or a traumatic experience to the joint itself. They can also be caused by muscular tightness. Stress can do it. So when you get really, really stressed, it pulls at the joint and causes pain. We can see it caused by an infection in the joint itself. So there's a lot of reasons why you can get TMJ. And when you get TMJ, it refers pain to other areas. So we rarely just see it just associated with the jaw.
Mm-hmm. And Diego, in your practice, are you seeing more issues that are causing this, like just jaw clenching, like for people who are clenching their jaw overnight when they sleep? Will that lead to the disorder?
So there's a combination of things that can lead to it. It's rarely just one thing. I mean, we call it bruxism, right? Like clenching, right? That can cause it overnight or even while you're stressed and working, right? It could be from sustained trauma. Sustained trauma can be from like a dental procedure where you have your mouth open for a long amount of time. You're not used to it, right? It can come from your neck, right? The upper cervical spine directly relates to the jaw, right? And then now we're talking about posture contributing to it, adding wood to the fire, because you got muscles that go into your hyoid. I mean, all these muscles here connect. These help with opening, these help with closing, and all of a sudden you're changing the biomechanics of everything, right? And so now one thing's pulling, there's a muscle that attaches directly to the disc. So now that's clicking because it's pulling it forward. And then now you're trying to correct this somehow. And it's like everything's adding wood to that fire. So there's not a specific cause, but people have been dealing for so long. They're like, oh, you know what? My jaw does click. Usually when I ask them, when I'm doing like a cervical eval, you know what? My jaw does hurt sometimes. It does click. And sometimes we just target the two muscles here. Headaches are gone, and we make a big difference just by kind of just going the extra mile and asking some questions about the surrounding structure.
Okay, so that brings up another question for me. If you're hearing the click, does that automatically mean that you have a TMJ disorder? And is there a sign that something's coming that you can catch early on? And when do you know what to do about it? Maybe Dr. B, let's start with you on that one.
Yeah, just because you have clicking in a joint, just because you have some sort of grinding sensation, that doesn't necessarily mean you have TMJ, right? You may have some dysfunction of the joint. We get clicking and we get popping in the joint, and that doesn't necessarily mean that there's something bad's about to come. But when we get pain associated with that clicking or that popping, then that's when you get a little concerned, especially sustained pain. And so I think one of the things that we all get is some type of clicking or popping in the joint, and that's normal. You can get some dysfunction in a joint, especially when you're stressed. That's not that uncommon. But if it's sustained or it's continued pain that's associated with it, that's not normal, and that is a concern.
And
Diego.
also going off of what Dr. B said, like, yeah, we have joint noises all over our body. As long as it's not painful, we're okay, right? So I think once it gets to the point of sustained pain, and then if your jaw starts kind of like catching or locking a little bit because that disc maybe is blocking we call it anterior translation of the jaw, right? That's when it becomes a problem because it alters the biomechanics of the jaw. Now you're using this side more, right? Maybe this side's kind of hitting where the disc doesn't want to be, pushed. And so it becomes a chronic situation. And if it's sustained pain, then it can lead to actual damage here to the disc, to the joint, or the muscles. Again, like you were saying, they get really tight, and then that can refer pain everywhere else as well.
So I know physical therapy is one of the treatments, Diego, because I know you work with several patients. I do want to go a little bit deeper into treatments before we bring up a patient example. It seems like since we're talking about the jaw, that the first thing that you should do is to go see a dentist. But so from what you're both telling me now, this is a joint issue, which is orthopedics. So what do you both believe should be a patient's first line of defense? And then like what I mean, should they go see a dentist first, or are you the first line?
I'm a little biased, I would say, I think that, when it comes to orthopedics, joint muscle pain, nerve pain, anything related to just the physiology of the body, right? I think you should come see a PT first, because more likely than not, if it's an acute type of symptom, acute type of pain, we can give you some self-management tools that you can kind of use, so that way you are able to manage your own pain, right? Or at least give you some education. Hey, look, like this is temporary, because a lot of times this can lead to a lot of catastrophization, right? So like people just get really stuck in that this pain is going to go forever. But we can educate, give you some self-management tools, and then of course, like, see your dentist if you need to, because sometimes it could be like a malocclusion, right? It could be a alignment of the teeth, right? And I think more than anything, we got to work collaboratively with everybody, right?
Mhm.
Regenerative med, with the dentist, and with the PT, because all in all, like, the point is to make sure that the patient doesn't have a lot of pain. Then we give them tools to decrease that pain, maybe relax the muscles, and then if in the end we need to send them to regenerative medicine so they can have another intervention in case other interventions fail as well.
I mean, I completely agree. I think, one of the things that patients, anytime a patient has clicking in the jaw or any other concern, first thing they think about is, this is my teeth. I go see a dentist. And, I'll tell you just from speaking with a lot of dentists out there with patients that have TMJ, most of them don't really know what to do at that point. They're great with teeth, and they're fantastic when it's a misalignment issue. But the problem that we see with TMJ is that it's not always just that. And so, the next step for a dentist is, well, let's put a mouth guard, or let's put some type of device in. That's not always the answer. But we know that when we talk to dentists, they don't really have another step in it. The reason why I think it's so important that the first step should be on the physical therapy side of it, somebody like Diego, is because they can really assess the joint. We can really understand why you have TMJ, right? Why the dysfunction actually exists. And if that involves, a muscular problem, we can treat the muscular problem. If it involves some sort of misalignment of the teeth, then we maybe should get them to a dentist for that device. Or maybe we fail all that, and we need to do something like regenerative medicine, or even something potentially even surgical, which we don't really love. We can do that. And so I think the quarterback of TMJ should be on the physical therapy side of it, because they're really the ones that is assessing the joint space itself. And they can really tell us what that next step is, instead of just going in and only have one potential option with dentists.
Mm-hmm. So our Wi-Fi is going in and out. So I want to make sure that I catch. There was a part that was cut off from that, Dr. B. I want to make sure that we get that into this. So when you were talking about going to see physical therapy first, I think, just to summarize, tell me again, because the physical therapy opens up the doors to other potential problems, or the other potential solutions that you might not otherwise get from a dentist. Is that right?
That's right. Yeah. I mean, with physical therapy, when physical therapy is the quarterback of treating the TMJ, it allows us to figure out why we have that problem, instead of going in and trying to treat it and hoping that we have the right answer of why. And when we go see a dentist will assume that this is misalignment that's causing it, and that's not because it's lack of care. That's what they see on a regular basis. And on
Right.
the physical therapy side of it, we can look in and say, maybe that is a misalignment issue. Maybe that's a muscular issue. Maybe it's a joint related issue. Maybe it's a disc issue. And we can kind of really assess that. Rarely is it one problem. Really rarely is it one reason for this. And so you go and you try to treat all of them in tandem, and that's how you get the best results.
And a lot of patients stall out. Like they're not able to get to the answer. And is that because it's too narrow when you go see a dentist for this? By coming and seeing, an orthopedic, physical therapist, you have a wider range of potentials that you're investigating, correct?
Right. Yeah, absolutely. I mean, when you're seeing a physical therapist, you have the ability to go lots of directions, right? When you see a dentist, you're really going that route of a device, right? And so, when we see a physical therapist, they can get you to a regenerative medicine doctor. They can get us to a dentist. They can get us to a different type of massage therapist. They can use different type of tools to adjust the joint itself. But before we try to treat anything, we have to really understand why something is happening. If we don't know why it's happening, everything that we do is going to be a temporary result.
Right.
Yeah, that makes total sense. All right. So, Dr. B, I know you worked with a patient named Caroline Ward who had a very bad experience with TMJ. She had been everywhere. She was at her wits' end, sort of what we were just talking about here. So, I want to introduce her story now, and then we're going to come back and talk about some of the common symptoms people should be looking for, what steps they can take, and a little bit more about Caroline's story and how it relates to so many other people. So, first, here's Jennifer Davis with Caroline's story.
Jennifer Davis here with Caroline Ward. Caroline, thanks for joining us.
Thank you so much for having me.
Okay, so today we are talking about TMJ, and I feel like that's something we hear about all the time, but I wanted to make sure we start with a definition, and you're going to have to do the pronunciation for me.
Yes.
It stands for the
temporomandibular joint.
Right, and let's point to it for those of us watching on YouTube,
Yeah.
right? It's
where your jaw joint, the one that hinges.
Yep. Exactly. Okay. And so when we talk about TMJ, we're talking about any sort of pain that's associated with that kind of jaw. So we hear about it with people who grind their teeth or clench, or it can be, something genetically that's happening or an injury. It affects a lot of people. I don't know. Tell me if this number surprises you or not. 10 million people in the U.S. Deal with TMJ disorders. Is that?
Yeah, I would say it doesn't surprise me. I definitely, the severity is what, plenty of people live with, a TMJ disorder or, dysfunction in their life with no pain. But many of them do then also experience pain. So
I was saying, and you were one of them. Yes. And it looks like most commonly this is affecting people between the ages of 20 and 40. You are on the younger end of that in your 20s. Yes. And when you mentioned, severity, your case was super severe. And it also went on for a little while, right? I mean, in some ways it's been your whole life. You said you started grinding your teeth probably as a little kid, but when did the pain really start?
Yeah, so definitely been grinding my teeth, my entire life, unfortunately having just a more severe case. But I would say the pain really started to, develop and affect my everyday life probably about 3 or so years ago. That's when, just everyday eating, talking, sleeping, overall health was, impacted and affected.
So when you say it was impacted and affected, and talk about how bad was the pain? Was it consistent? Did it vary? How bad did it get? And what did it get in the way of?
Yeah. So I would even going even a little further back, about 6 years ago, I experienced kind of like a lockjaw, which is common also, but had to go through a procedure called an arthrocentesis to get it undone. That fixed the problem, but I still had some pain. But, kind of fast forward, then COVID happened and, just trying to navigate life, put it off. And then again, a few years ago when the pain started to get really bad, I mean, it is aching constantly, so pain 24/7, really intense, sharp pain episodes, like sharp and shooting pain. Most often when I would be talking to someone or eating multiple times a day, and then that also just comes with disrupted sleep. I would have fullness in my ear when I was working out, any type of like high intensity training or weightlifting. I would just feel all the effects of the inflammation, so kind of muffled hearing as well, while you're trying to work out or talk to people is interesting to deal with. So.
Oh, goodness. And you're so young, so it must be like, what's going on?
Yeah, I know. It's like, I feel too young for this to be.
Did you know anyone else who had it? Were you dealing with it and sort of figuring it out on your own?
I would say figuring it out on my own. I have some friends that'll, have some jaw clicking here and there. But again, a lot of people can, it might just be the clicking. And that depends on whether or not medically it's with or without reduction. And one is worse than the other. And mine was, the worst case. And so actually, once you get past the clicking and the popping sounds, is where, the breakdown really starts to occur and where more intense pain, comes into the picture. So
because you developed osteoarthritis in your jaw joint and your disc was degenerating, right? I mean,
yes.
that's
Yeah.
the
And I
point it
mean,
got
it's one
to.
of those things where nowadays, you get the MRI report before your doctor gets to read it with you, which is, probably a bad thing for someone like me that's going to dive in and read it right away, as I'm, looking at all these words that that was like the technical diagnosis of the actual MRI technician. And, kind of freaking myself out. I'm like, at the time I was like, I'm 26 years old. I can't have osteoarthritis. So yeah, I mean, very just a lot of pain and a lot of stress of, oh my God, am I going to have to, live my life, the rest of my life this way,
Because, yeah, I want to dig a little. You were telling me, hard to fall asleep, waking up in the middle of the night. You were adjusting your diet because there were some things like hard or chewy bread you couldn't do. Right. It was impacting you when you were working out. And then the amount of things you did to try and get relief. You spent a lot of money trying all sorts of different treatments. You did NSAIDs, you did Botox, because Botox is supposed to help, like, I guess, reduce the inflammation, right? You did I don't know, what else did you do? I know you did a bunch of
Yeah,
things.
I
You
mean,
had
I did physical therapy. That I even, I did some dry needling, which was beyond painful. I actually couldn't stand the pain, so I didn't, if that would have helped, I wasn't able to, to continue with it. Um, you know, Botox. I tried different mouth guards, like you said, the, anti-inflammatories. I'm also, in a community choir, and I sing, and I mean, I have 2.5 hour rehearsals every week. And I mean, even just being, I mean, I would, have to take breaks. I'd be in pain while I was singing. You don't realize how much um, how much just talking or moving your mouth, could affect you until you're in some type of pain where you're like, I can't even do this the whole time. So yeah, a lot of time, a lot of money. And Botox helps some people, but insurance still doesn't, at least my insurance said that it wasn't a proven treatment. It's experimental. And so none of it was covered.
so by the
Unfortunately.
time, like, we're about to get to the good part, but
Yeah.
before you got the help, were you despairing? Were you still hopeful? What was your emotional state? Because this sounds really hard.
Yeah. By the time I made the appointment, I was like, my grandmother actually found the, gave me the recommendation and had talked to the doctor about my situation before she said, you should schedule an appointment here. But I was pretty much at my wit's end, and I went into the appointment like, we'll see how it goes. But I remember just kind of being like, I don't even know if there's anything you can do for me, because I was, frustrated trying all these things and spending all this money and, just continuing to be in increased pain.
And so the appointment we're talking about, you met with Dr. Niteesh Bharara at VSI in Reston, Virginia. And you told me when you saw him, you were in tears. I mean,
Yeah.
you were at a low point for sure. And Dr. B looked at you and said, you're not going to be in pain forever.
Yeah.
Did you
Yeah.
believe him?
I think at the time I was like, look, I'll try anything. But the thought of, I mean, I hadn't not been in pain for so long that I was like, okay, we'll see if what you're saying is true. But, there's always going to be that doubt that, I was told the same thing before. And it
you
continues.
said a
Yeah.
lot of doctors had said that to you before and no one
Yeah.
had been right.
Yeah. This is common. You're not going to be in pain forever. But, just because something's common doesn't mean that, that it's going to work for you and that you're not going to be in pain. So
Now, when he went through the list of what you'd done, he was like, all right, anti-inflammatories, check, PT, check, mouth guards, check, like Botox,
yeah.
check. You had done all of the things. So what
Yeah.
did he suggest to you as the next step?
Yes. And he said, I mean, he was like, you have run the gamut here. So you are an excellent candidate for, PRP. I don't really know if I had ever heard of it. Or what, I can't
It's a
remember
type
if I
of
had looked it
regenerative
up before.
medicine.
Yes. But platelet rich plasma, which he basically explained to me is kind of a step below, stem cell regeneration and treatment. But that, if I was a good candidate for it, which based on all my experience and how nothing else had, that was less extreme had worked for me, that they would basically take my blood, run it through a machine, and then inject it into the pain site, at my jaw joint to help stimulate, regeneration of basically let my body heal itself. But yeah, so
That's
I
a
was like,
fantastic
yeah.
description of it. That's exactly what it is, right? Right. It's allowing
Yeah.
your body to heal itself. And so you had this done in October of 2023, and we don't have to go on into all of the details, but it was painful, probably in part because of the location, like in your jaw. I mean, it was really hard. So we don't need to go too much into that, but tell me what it was like in the recovery. This is an outpatient procedure, so you're not going into the hospital or anything. You walk in, you get it done, you walk out. What are the next couple of days like after you have the procedure?
Yeah, the next couple of days I was pretty sore, pretty swollen. I went back and stayed at my mom's, and was
Were you
under
having
mother's
second
care.
thoughts, or were you hopeful at that point?
I was hopeful at that point because, through, again, unfortunately, the internet nowadays lets you look up all the horrible possibilities yourself. But I was either like, this works for me, or I'm going to need to get some horrific jaw surgery one day, which, they really recommend against open jaw surgery because, it's just one of those things that doesn't necessarily go the way, it wants to. I'm like, oh my God, it'll change the structure of my face. So, I won't even be me again if I have to do that one day. So yeah, the next few days were were pretty painful. He did say that this is, the most painful spot to get PRP into. But after, the swelling and the soreness went away after, probably about the first week, I was like, okay, let's see if, over time the pain dissipates. And to my great surprise and on emotional reaction, it did. I don't know why I get so emotional when I talk about it, but it's hard to fathom that I was in so much pain and now I'm not. So
of course you get emotional. You're going to become emotional. Of course you did. You don't hurt anymore.
Yeah.
That's the thing with PRP and with regenerative medicine is you don't flick a switch and it's not automatic. So you've got to give your body time to heal. Those things, that regeneration takes some time. So at the 3-month mark, you were still a little bit sore, but you were having less frequent shooting and stabbing pain. Like, was that the point where you started to think, all right, maybe something's happening here?
Yeah, I think so. Cause it's always hard when someone asks, when you're asked to rate your pain or how's it going, I mean, sometimes you're just going through the everyday motions of life and you're like, I don't know, how is my pain? Is it better? But when I would think back, to the sharp shooting pain episodes, which were almost daily, I'm like, that had significantly decreased to, maybe weekly, fewer than that. And that's when I, really thought, this has only been the first 3 months and this is, this takes, even longer to provide its full benefits. So maybe this is actually going to be, this will actually work.
So then you hit the 6 month, your year anniversary was in the fall of 2024. So we're a little bit past a year now. And that, at a year, you should be seeing a pretty good amount of regeneration. So where are you now? What's going on?
Yeah, now I am, feeling great. I have no sharp shooting pain episodes.
Ever or at all?
Ever at all. Yeah. I occasionally feel a little bit of fullness in my ear from still just inflammation that takes time to die down. But, I would take living with that for forever if it meant none of the other stuff. But, it still just continues to improve. And
you're still wearing a guard or a retainer at night, just to make sure. But when you work out, you're doing well. When you're singing, what's happening when you're singing and eating and sleeping?
Yeah, singing, eating, sleeping, everything has just improved so much more than I ever thought it could. I don't experience like soreness or just like exhaustion in my jaw when, throughout the duration of my choir rehearsals. I'm back to, I still, I'll watch what I eat or how hard I bite down on something just because, probably everyone should, with their teeth, but yeah, just really come full circle with it.
And you were saying when we talked last that it sort of opened up your life even in other ways, like when you're not gripped with pain all the time, like everything's better, right?
Yeah, yeah. You don't realize how much it weighs you, or how much it weighs you down, and was potentially affecting other things. I mean, especially even my mood. I'm like, no, I don't want to go do that. I'm in pain. I mean, just physically hanging out and talking with my friends, like my mouth would get exhausted and I would be, discouraged and annoyed. I'm like, okay, I'm leaving, So, I mean, yeah, I don't think I knew how much it was affecting me, but didn't know how much better things would be with the pain gone.
So let's wrap this up with a pep talk for anyone else out there. There's a lot of people who have TMJ, and look, this PRP, regenerative medicine, it's used for a lot of different things, and yet it is still considered a newer treatment. You will find some traditional doctors saying, "Oh, we need more research." You'll find so many doctors and patients with anecdotal evidence and experience saying it's transformative. So, what's your advice to other people out there if they are in that level of pain that you're in, if they feel like they've tried everything? What are the lessons you've learned here? What would you recommend to other people?
The first lesson I've learned is definitely that, I mean, if you're in that much pain and it is affecting your everyday life, there is no option that you shouldn't explore. Even once you're at your wit's end multiple times over and over again, if there is then something new and it's something you're able to pursue, that you should go for it. The second thing is, I mean, with PRP, it really is. I mean, it wasn't anything foreign that was going inside my body or anything.
No, it's from you.
In that sense. I mean, it really is just your own blood, manipulated in a way to better help your healing. And so I think it's, very comforting to know that it's just, my body helping heal my own body. So definitely a huge advocate for it, for anyone that can, that can look into it. So.
All right. And wrap it up on this. I mean, I know this is the turnaround you'd hoped for, but do you have any moments where you're like, are you stunned at the transformation or just grateful, or what would you say?
I would say, it's times like this when I'm asked to sit and reflect on it. I mean, that is why I get, so emotional, that it's hard to believe. And I do feel so stunned, but at the same time, the improvement was just so gradual, and, it takes time, that it's, kind of when sudden pain can come on so sharply, and then this just slowly kind of, faded away. And so this is my new normal, and I'm definitely sticking to it.
Amazing. Caroline, thank you so much for sharing your story. I hope the people who
so
need to hear it hear it. So
yes,
thank you.
Too.
So now we are back with Dr. Bharara and Diego Herrera to empower patients and to talk about the treatments that are available. I know VSI takes a very different interdisciplinary approach, which is what worked for Caroline, incorporating both physical therapy and regenerative medicine. So first, let's talk about Caroline's story and your takeaways, Dr. B and Diego, on that, and how that's so relatable to other patients.
Yeah. Caroline, she was in a really tough situation, right? So she has had TMJ that started off with just some mild discomfort, and then continued to advance to fairly severe pain, to a point where she had pulled away from her friends, pulled away from her family. She had limited her eating. She just couldn't do it anymore, and so she decided to stay home and move away from this. She had pain with almost everything. She couldn't exercise anymore because she couldn't run, because that caused pain. She couldn't eat. She had trouble swallowing. She didn't want to speak for long periods of time. She loved to sing, and she couldn't sing. So she had moved away from all these activities. She started off with treatment with the dentist, and she saw multiple dental specialists for the TMJ, and so tried multiple medical devices that didn't seem to make a difference for her. She went on the path of physical therapy that seemed to not, to have some sort of improvement, but didn't get us where we needed to get. Mm-hmm. And so she was, at that point, she was having the discussion whether it's going to be a surgical answer, or whether if there's anything in between. And we know that when you potentially go to surgical, there may not be any way to come back. And even after surgery, she was told that she was going to have to limit much of the activities that she enjoys doing.
Mm-hmm.
In this situation, we were able to use regenerative medicine, specifically PRP in her situation, to really treat her TMJ and her dysfunction of the joint itself, and really getting her back to all the activities that she enjoys doing.
Yeah. Diego, what does physical therapy look like for someone suffering with TMJ disorder?
Well, the initial evaluation is going to look at their jaw range of motion, their cervical range of motion. We'll look at trigger points that can refer pain to the surrounding structures. Once we get a full assessment, on what their stressors, triggers, their aggressors are, then we pretty much dictate what we're going to treat first, right? Because we need to treat either the most irritable or the most like home run portion of our exam. So I use different modalities. I can use like dry needling, which is really, in my opinion, a home run for most people. And then I do joint mobilizations. I usually send them with an exercise or two, not too many, but things to relax their jaw. We talk about their stressors in their lives, like psychosocial stressors, because that can contribute a lot to the clenching, and also just stress in general can really tense up the upper body. And I sometimes give them, hey, look, try some mindfulness, try yoga every once in a while, just to kind of relax things. And then if I see them the next time, we do a measurement before and after the treatment to see if we made a difference in the range of motion. And then give them a little homework, but anything, it's a lot of education at first, honestly. It's a lot.
You hear this, right? A lot of patients that I see have come and had physical therapy before, but then you hear how Diego just put it, right? Seeing a TMJ specialist do physical therapy and do an evaluation and treatment is very different than when you see a regular therapist assessing the TMJ. Most aren't doing measurements, with how they're able to open their mouth and close their mouth. They're not really assessing the intraoral aspect of the TMJ. They're not dry needling these areas. It is very, very, very important that you are able to see a specialist that understands the TMJ, and not everybody has that specialty. And so, this is very unique. We don't normally see that. When I see patients that say they failed physical therapy, it's not this type of physical therapy. It's physical therapy that works on opening and closing the jaw, not really the assessing the TMJ or why that's the problem. So this is extremely different than what you're going to get other places with other physical therapists.
Okay. And I know the two of you work together. So in physical therapy, maybe, you may be having some success with that so far, but you need something else. Dr. B, you said that regenerative medicine can come into play for some patients. Talk about the regenerative medicine element of this, which I know was something that Caroline used. How does that work to alleviate the TMJ? And then maybe if you could talk about the patients who are ideal candidates for this kind of treatment.
Sure. Yeah. When somebody has TMJ, the first step is always the physical therapy end of things. And the reason why it's so important that they do the physical therapy and work with a good physical therapist is because the communication back and forth is extremely important. Because one of the things that I always ask Diego is I ask him, so what are you noticing on examination? What are you seeing? What muscles seem to have normal to you? How's the disc? What type of motion causes the pain? Have you had any successes? Have you had any failures? What seems to make a difference? And that helps me decide what that next step is to push the patient forward. Right? Mm-hmm. In Caroline's situation, we used PRP to push her forward.
Which is platelet-rich plasma. So you're pulling out the healing elements from the blood to put back into her body, correct?
Exactly. So this is a regenerative medicine procedure in which we draw blood, we get the growth factors out of it, and then we inject it directly back into different areas to promote healing, to reduce inflammation. And in the TMJ, what it can also do is it can spur synovial fluid, the fluid that lubricates the joint. It can cause that to occur. And what we do is we treat the structures around the joint to gain stability and decrease the dysfunction of actually the joint itself. And so that's how we use regenerative medicine in Caroline's situation. And that's how we would do it in other patients as well. the ideal candidate for a regenerative medicine procedure is somebody who has failed physical therapy or has had improvement, but maybe has started to see a plateau. And in those situations, after a discussion back and forth, we can really assess maybe what seems to continue to be a problem, but is only getting temporary benefit and not maybe taking the next step. Maybe we're able to mobilize it, but then it's getting really tight. Maybe we're seeing the dysfunction get better in the short term, but still an unstable joint. And we can address and inject those different areas with the PRP that we just talked about, and we can get that tissue, that joint, to become more stable and that tissue to actually heal.
Okay. And Diego, how much, I don't know if it's possible to quantify this, but how much improvement is actually possible with PT? And at what point do you realize that PT may not be the most effective treatment path?
Right. Yeah, that's a very complicated question because PTs love to say it depends, right? Like, it really depends on a lot of factors, right?
Yeah.
So I think in my experience, I've had multiple patients achieve close to 100%, of recovery, and that's usually the cases we catch early on, right? Because we're like, all right, let's just educate, release here, or relax the muscle here, mobilize. Here are some exercises. If you get a flare up, do this, you'll be okay. The chronic pain patients are really the ones that are the more complicated ones, because now when we start talking about the involvement of the upper cervical spine, you get mixed signals into the jaw because of just a constant chronic pain that you have, right? So with that, if we can get up to 80% improvement, and then give them, tools at home to manage it, I think that is a very good goal for a lot of people, right? Now, that may be staying out of painful ranges when they open their jaw. That may be, hey, look, like, maybe don't eat that burrito, and maybe don't chew, don't get a ribeye, and just for a little bit, just when you feel like these flare ups coming up, you really you start noticing it, and you gotta stop feeding that fire. But that's why PT is great, because you just provide so much education to these patients, and they take it and run with it. And that's the best thing that I see. I'm like, hey, like, oh, I did notice I ate Doritos, and the crunching really kind of, started getting, my jaw going. So I stopped, and then they're like, and it like, it gives them hope, because like, oh, and my pain stopped like the very next day or something, right? So
Probably because they feel like they have more control over this.
100%, yeah.
Yeah.
Again, they're not going in a spiral of like, it's going to get worse. I don't want to do this. I don't want to do that. Well, if I do this, and it just becomes, it can lead to a lot of anxiety and depression because of the lack of social interaction, like Dr. B was saying, or just not feeling like yourself, feeling like a shell of yourself, right?
Yeah.
We say in PT a lot that we see people at their worst, and we have to kind of help them get back to the normal functioning lives, because it can affect a lot of who you see yourself as.
So Diego, I know this is a real specialty for you. Do you recommend PT along with regenerative medicine? Is that best for optimal healing, for the continued healing?
I think so. I mean, I really think that, we see other cases with PRP and like the neck, the back, even like the hip sometimes, and the shoulder. And PRP is great at, starting a new healing phase. And then that's where PT comes in, because we really got to load the joint, move it around, pretty much tell the brain, hey, look, we need this joint to do this. We need this muscle to do this. So we try and tell the brain, we need you to increase this capacity, the resilience of this joint. And with PRP's help, the brain's like, okay, let's go ahead and start healing. And now you got more people doing the work of like, what a failed healing response was before. And
how long do the effects of regenerative medicine last for TMJ disorder? Is this something that, you've got to go back again 3 to 5 years later? I know Caroline mentioned that she might need another procedure in some time. Dr. B, what's your take on that?
Well, I think it depends. Just like Diego said, right? As Diego said, physical therapy is usually very, very, very helpful in these situations. And it's helpful not just because you're treating the joint itself, it's because you're treating all the other issues that come along with TMJ, from the depression aspect of it to the mindfulness aspect of it. When you're adding regenerative medicine on top of it, this could be curative. And so in certain situations, we see this become curative, just like physical therapy can be curative to these problems. But we also have to remember that there was a reason why this happened, right? There was a reason why TMJ happened. And if we are not changing why it happened, then it will happen again. And so, with regenerative medicine, while it can be curative, we need physical therapy to change whatever is causing it or has caused it. And we need to adjust that or modify it so that we don't continue to have this problem. So yes, maybe again in 3 to 5 years, we would need it again, but it would depend on what happens over the next 3 to 5 years, or this may be curative in nature.
So, and Caroline really had a complete turnaround from going to her wit's end. She didn't know where to turn. She had had so many episodes of failure. Is her, and she has zero pain now, a year out. Is that typical? Do both of you see this happening with patients where they are able to just turn around and have no pain going forward?
On my end, yeah, I see this. It's not atypical to see this result, right? Something great about Caroline is Caroline was very motivated. She was motivated to get better. She wanted to get better. She put the effort into getting better. And I was lucky enough just to see her the other day, and she's still doing absolutely amazing. And she's back to traveling everywhere she wants to go. She's extremely happy. Her job is going extremely well. So it's so nice to see that side of her versus the first time when I met her. So I see these things become curative, but it's not just from a regenerative medicine procedure. It's not just from a steroid injection. It's not just from anything like that. It's from the overall treatment. It's from regenerative medicine to physical therapy to understanding the depression and the hypersensitivity that comes along with it, and treating all that together. That's where you get the optimal result and where it truly becomes curative in nature.
Diego, you would agree with that you can be cured?
100%. I think it's the collaborative nature of this very like limiting disease, right? Or dysfunction, right? I think that if you're able to target everything at once, it's great because me increasing their range of motion for 2-3 months is not going to make a big difference in their life unless they're able to stop the stressors, the aggressors, right? And the hardest thing that we see in PT is again putting in the work, right? The adherence to the program, right? Like the just doing your exercises whenever we tell you to do them or whenever you can, not eating that chewy substance just so that you can kind of keep your symptoms at bay. And then letting your body kind of tell you when it's okay to reintroduce these things, right? And that's part of the PT too. We educate again. Hey, modify this for a little bit, see how you feel. Modify this. Then we say, all right, reintroduce this. All right. Then next time I see you on Thursday, we'll do a little treatment, a little recovery, and see if we're able to kind of get you into the next stage of recovery. But yeah, all this stuff can be very curative. And again, it's stopping all the wood being put in the fire. That's what it is. It's making sure that they understand what their aggressors are.
That's such a great analogy, the wood being put into the fire. I mean, really, for a disorder that can wreak havoc on your whole entire body through one minor joint, the fact that there is hope and that there is a treatment plan, that you guys work together on this is really, I think it's really something remarkable. So Dr. Niteesh Bharara, Regenerative Medicine Director at VSI, and Diego Herrera, VSI Physical Therapy. Thank you both so much for the insight on this and the providing the hope that I know a lot of patients really want to hear. Thank you.
Thanks for having us.